Welcome to another episode of Cutting Edge Health. Today, we're talking about a topic that is very appropriate for February and Black History Month, and that is sickle cell anemia. What are some new treatment options, and what has been the current state of treatment? For those of you who have not heard about sickle cell anemia, we're going to give you a background and explanation of how it presents pain and how it causes pain, and how treatments historically have initially been utilized in order to be able to try and treat that and prevent it. And we're going to talk about some of the upcoming ways that are actually developing in order to be able to not only give an improved pain relief, but also prevent some of the other side effects. If we haven't met, I'm Dr. Orlando Landrum, a physician that talks to individuals about how you can be empowered in terms of taking pain and moving it back and stopping it and taking control of your life and getting back to leading the life that you deserve. For those of you who those of you who are joining us live. As always, we really appreciate you and your support. And if you feel like this video is of value either now or going forward in the future, please let some other people know. So let's talk a little bit about sickle cell and its impact. Just in regards to regular pain, for those individuals that have chronic pain of some sort, frequently it results in an emergency room visit. And when we talk about sickle cell, they actually looked at some patients that were present in California and their frequency based off of their age range. And one of the things that they saw is the following. So for those individuals that were 0 to 16 years of age, that about they have maybe one visit a year. But as you start getting older, you say anywhere from 3 average visits per year, and then past the age of 60, you might kind of drop down to 1. So the question is you have these ER visits, how well do we really think that we've been doing for a number of years? Or actually, there was a number of papers that looked at this, particularly a paper that was present that evaluated Johns Hopkins, that said the study affirms challenges in managing severe pain of sickle cell disease. And a couple other different articles have shown the same thing. It's been something that has been a challenge, and we'll allude to that in terms of how physicians and other healthcare providers have had a historically difficult, challenging time to be able to try and treat sickle cell disease. But let's back up. Let me give you, as we always do, the literature that we're going to be referencing, so that way you can see it for yourself. We're not massaging the numbers. You can figure it out and you can say, hey, this makes sense to me. So some of the papers that we're referencing are the following, referencing recent advances in the treatment of sickle cell disease that was put out by the National Institutes of Health and Children's National Medical Center in DC. And then in addition, we're also looking at drug therapies for management of sickle cell disease, which is the Department of Hematology of St. Jude's Children's Research in Memphis and University of Tennessee. So when we talk about sickle cell disease, what exactly is it? Well, it's the following. Sickle cell disease was originally diagnosed in 1910, so greater than 100 years or so ago, by Dr. James Herrick, who described a case of severe malaise and anemia in a 21-year-old dental student. And what they noticed is on a blood smear, they saw bizarrely shaped red blood cells, that the disease seems to be a change in the red corpuscle itself. And more than 100 years later, we find that is a single base substitution in beta globin, and that disease is not just present in the United States, but present in other places, which we're going to talk about in just a second. So let's kind of give a simple explanation and then a more in-depth detailed explanation and then a more scientific explanation. As you guys very well know, we talk about how do we be able to provide that value so that you can be able to So when we talk about sickle cell, one of the things that we know is that it's a blood disorder. And that blood disorder it affects red blood cells, and it causes, as we talked about in that historical piece, these misshapen blood cells. And these misshapen blood cells can cause painful complications where the blood gets stuck in different parts of the blood vessels and doesn't allow oxygenation to take place. So a more in-depth, detailed explanation of that is the following. So when we take a look at this picture, we can see that DNA, as mentioned before, has a change in one of the areas, and that change can result in changes to the actual red blood cells that deliver oxygen to our tissues. So if we're looking at that with a little bit more depth and detail, what we'll see is the following. So if you're using a fancy evaluation of it, you see this hemoglobin S, which is different than traditional, that results in the sickling of blood cells. And then that can result in these blood corpuscles rupturing, and that can cause a whole host of different things. It can cause everything from an occlusion, or meaning a blockage that's present of the blood vessels, that then can cause, because there's lack of oxygenation, problems with inflammation or other problems with the vessel. And there's a whole host of different pathways that really can cause some of this. But at the end of the day, we know that it can be pretty prominent, and it can cause a number of different organ issues, which we're going to talk about. And it affects people of quite a few varied regions. I think historically, we thought that this was okay. So I think I have a message, no sound. Can you guys hear me right now? Let me know. Send me a message. Yes? No? Maybe so? Perfect. Okay, we're cooking with fire. All right, so going back to this, we actually can occur in a number of different places or in terms of the historical reference of where people come from. So it can occur through a number of countries that are present in Central and South America, certainly those descendants that are from Africa, the Middle East, India as well. The actual disease can affect as many as 100,000 individuals. Sickle cell disease occurs in about 1 out of 365 African American births, but about 3 million people can have sickle cell trait. So when we talk about the explanation of like what is the impact just in the organ systems, it's actually that membrane damage to the corpuscle results in those blood um, corpuscles either potentially rupturing or becoming sticky. And that stickiness can basically cause an occlusion or blockage, which is the same type of thing that you can have if you had a heart attack or a thrombotic type stroke. Or if you have hemolysis, which is this breaking up of these blood vessels, or rather corpuscles, it can result in a whole host of different things like issues with the vein, issues with cellular activation, oxidative stress. And what that results in from an organ standpoint is actually pretty varied. Most people think, oh, well, a sickle cell crises is just going to result in just pain. But actually, it's more diverse than that. You can have everything from a stroke where it clogs blood flow to the brain. You can have acute chest syndrome, which is a life-threatening condition that mimics the ways that pneumonia presents and can cause symptoms like chest pain, coughing, difficulty breathing. You can have kidney disease because it's an end organ and because it doesn't perfuse well, it can cause a whole host of different issues. And you can have venous thromboembolism. So the same way as you'd have a DVT or a PE, all those things are impactful. And I'll tell you, being a physician that now is a quote unquote attending, have been done this for quite some time. One of the things that bothered me during my medical training is, there's a number of different references of how we refer to patients. So if someone has lung disease and we have something that's called chronic obstructive pulmonary disease, we sometimes call those individuals COPD or COPDers, right? If you have someone who has cystic fibrosis, there's a similar name. But for sickle cell anemia, there's a name that's called sicklers. And to me, I always kind of felt like, though it's used commonly in the medical field, is not really used without having a derision or derogatory component to it, at least the way I felt. So I think that there's ways that we can look at how impactful sickle cell disease is to those individuals who have it, and how can we be able to serve and be able to treat them better. And one of the things that many medical providers don't know is the impact on the end stage of life. So when we take a look, one of the things that we can see is the following. Is life expectancy from 1900 to 2000 is most individuals, as you have listed here, all Americans, right, will traditionally live somewhere between 70 and 80 years old for life expectancy. And what we see for sickle cell disease is that at least in the early 1900s, many people didn't make it out of the pediatric stages, right? And then in the 1980s, you start seeing this start to expand. And then in 2000s, now you can see that most people can potentially have a problem around age 40 or so. So it's really still a problem, right? One of the things that you can see are all the different interventions that provided some degree of benefit for patients. And we'll talk about that in a little bit. But let's talk about how, as I kind of alluded to, physicians and healthcare providers sometimes can have challenges and trouble with treating patients. And most of the time, those treatments will be like things like hydroxyurea, oxygen, and then some type of pain medication. And there's a lot of stigma that's associated with those things in an acute crisis, which is very difficult to be able to clarify. When you have a heart attack or a heart problem, you can use an EKG to be able to clarify. When you have a lung problem, you can look at pulmonary function tests or chest x-ray or a CT. But when you have pain, it's a much more difficult to be able to derive whether there's a causative element. And in the case of sickle cell, that certainly can be the case. And trying to be able to treat it can make for a bit of a difficulty for healthcare providers. So what we see is about 80% of family physicians report feeling uncomfortable treating patients with sickle cell disease. 73% of family physicians believe that more education and support tools would help avoid complications. And 69% of family physicians report that clinical decision support tools could very well be useful for helping them be able to treat patients, right? So let's talk a little bit about further how that impacts patients, right? So 75% of adults with sickle cell disease have painful crises that cause them to get hydroxyurea, the supposed recommended treatment. We're going to talk a little bit about why that's a bit problematic and what are some of the new things that are out there. But in the short term, we're going to kind of just work with that. So that means 25% don't get traditional treatment. Of children with sickle cell disease, about 33% receive regular screening for stroke going forward. And 73%, as mentioned before, family physicians believe that more education and support tools could be helpful in avoiding and managing complications. So the next slide is going to give insight about the timeline of what has improved and what has changed in the treatment of sickle cell disease. And so it shows from 1910 to 2010, a number of different treatment options that are present. We knew about being able to use antibiotics like penicillin. We knew about being able to consider starting to use possibly some form of gene therapy. But those things have evolved rapidly. And you can see on the right-hand side, since 2010, the evolution of being able to treat sickle cell disease with way more treatment options than what we originally surmised. For those of you who are kind of like, well, how does this impact me and having pain? And maybe I'm not a sickle cell candidate. Well, there's a couple of different reasons. One, we know that pain, neurologic, and vascular interplay certainly have a much more involved trajectory than what we originally realized. But at the end of the day, how to be able to treat this has other broader ranging effects on being able to provide value for a number of different painful conditions. So this paper is a standard management of sickle cell disease. One of the things that we know is that traditional sickle cell disease is treated in the following way. So normally, as mentioned before, it's treated with hydroxyurea, possibly L-glutamine, and a couple of other different medications that are FDA approved. There's the utilization at times of stem cell transplantation, and transfusion has been used with some degree of benefit. But there's some downsides to these standard treatment options, right? So what we see is the following, is that there's ways to be able to prevent things from occurring. However, the downsides are that they can have toxicities that are associated with it. Hydroxyurea in particular can cause all types of issues and can predispose towards different types of cancer, can decrease sperm count. It certainly can cause nausea and vomiting. It can change coloration of skin and nail discoloration. We look at L-glutamine, we can see that it has some other things that are associated with it that can make it kind of complex. And then some of the other treatment options can cause both arthralgia, which is joint pain, as well as headache and diarrhea, right? And then we have to kind of weigh that against not only their costs, but also how the body can be able to handle it. And what I mean by that is the following. We take a look at the body. Frequently, those individuals can have kidney problems, heart problems, stroke problems. And so we have to be able to see whether that medication can really be metabolized well. So when we look at the most standard medicine, which is hydroxyurea, one of the things that it can cause is the following. It can cause potentially leg ulcers. It has issues, as mentioned before, with possible issues with leukemia and cancer. It can cause problems with the generation of sperm and make a more likely degree of infertility. and it's a possibility it can cause some issues with pregnancy. So one of the thought processes is, well, how about transfusion? Well, transfusion, particularly when used over a consistent utilization, has its own problems, as I'm showing, and it can cause other issues like aplastic crises. It can cause changes with a hemolytic reaction over time. You can have transfusion reactions. So transfusions are not benign by any means. We talk about looking at stem cell. It also has some issues and challenges that are associated with it. So at the end of the day, what the heck is it to do? So let's talk about some other therapies and also have an understanding about what are we trying to do besides just treat pain, which is hugely important, but also trying to be able to preserve and give that person their life back. So there's a paper that is Emergent Disease Modifying Therapies for Sickle Cell Disease from University of North Carolina that looks at the following. It didn't just look at pain, it looked at what's happening with organ damage and downstream events, and how can we be able to deal with disease modification early on, not just symptom management, which is critical, right? So one of the things that they looked at were different therapies that can be able to help across the board. So we know about hydroxyurea, glutamine, and the other medicines that are out there that are currently standard of care. However, there are ways to be able to look at modifying the genotype. There are ways to be able to look at vaso-occlusion and be able to improve that kind of blockage that occurs. There are ways to be able to improve inflammation and be able to use treatments. And these have studies that are really starting to kind of move forward. So they're in phase 2 and trying to get to phase 3. There are ways to be able to impact polymerization. And there's multiple different ones that are looking at how to be able to modify the genotype. The reason why these things are important is because, as mentioned before in this previous slide, that looked at how can we stop you from having a stroke, a heart attack, from having a DVT. There are ways to try to prevent the crises from occurring in the first place, so that way you can be able to lead a more fruitful life. So when we look at different therapies that are out there, there are therapies that look at genotype changes that can take place, gene therapies as mentioned, and they have it all the way figured out to the type of what's the gene, how can it change what the expression is of the red blood cell, to looking at polymerization and how things can take place, and not just using hydroxyurea, but multiple different mechanisms of being able to improve that problem and issue. And then things like vaso-occlusion, which matter not just for sickle cell, but are actually have a broader utilization as well. And then finally, inflammation. And so all those things, as we can be able to surmise, tie back into pain, inflammation, vaso-occlusion, which is kind of that prevent of being able to have blood flow where we need it, and it matters. So going back to that chart, what we can see is that there's certainly differences in ways in which sickle cell can be treated besides the standard, which currently even the standard may not be being done everywhere. So hopefully providers are starting to be able to kind of broaden their utilization of treatment options, so that way patients can get better care, not just in the acute phase, but also in the long-term phase as well. So kind of summarizing it with the slide so you guys can have an understanding about all the different offerings that are out there. We take a look, it looks like the following. So we have ways to be able to stop the sickling from occurring. We have ways to be able to improve nitric oxide. We have ways to be able to improve the stickiness that was mentioned before. There are ways to be able to stop the coagulation and inflammatory cascades, how to be able to improve the oxidative stress, and how to be able to improve adhesion. All of these have different therapies, as was mentioned on that other slide, which is this one, that can provide value. So if you know someone that has sickle cell disease or someone who has sickle cell trait, giving them some insight into how you can be able to impact their crises, make them less frequent, or hopefully be able to stop them, is invariably and invaluably useful for being able to improve not only pain, but their quality of life. Thank you so much for joining. As always, really appreciate the support. If you feel like this might be a video that's valuable to someone that you know, please send it, copy the link, hit a like button, and subscribe. Thank you so much and have a great day.